Hi there, this is Dr. Paul Simon, psychiatrist. Wanted to talk to you a little bit today about borderline personality disorder versus bipolar. Borderline personality disorder is commonly misdiagnosed or not diagnosed at all when somebody has mood swings, anger problems, instability in relationships, a lot of different symptoms that I'll get into. The purpose of this video is just to kind of expand on your understanding of what it is and how to think about it. You can look at the diagnostic criteria for borderline personality disorder, and it's an extensive list, but what does it all mean? I've been in the practice of psychiatry for going on about 13 years now, and I've seen many people who struggle with a lot of different mood issues and anxiety and relationship problems. Now, oftentimes people will come to me and say, well, I think I have bipolar, or I've been diagnosed with bipolar, but in fact, what they struggle with is borderline personality disorder. Now, borderline personality disorder, if you look at the criteria in the Diagnostic and Statistical Manual, really highlights a lot of instability in relationships and anxiety that underlies their self-perception in relation to others and to themselves. So somebody with borderline personality disorder often will have, beginning around puberty, when a lot of hormonal changes occur and we start to develop and expand our social circle independent from our parents, we start to have some more intense mood swings, a lot of anxiety and worry and stress, and often with borderline personality disorder, a lot of insecurities and attachment issues. A lot of that can come with anger issues. So one minute somebody will be fine and somebody will say something wrong or misspeak or something, and the person will feel slighted or injured in some way, and their world will come crashing down. Oftentimes, people with borderline personality disorder will finally end up getting treatment if they've had some kind of self-harm or suicidal talk or behavior. Not always, but oftentimes people who feel extremely abandoned or like somebody who they thought was a good person or loved them dearly maybe turns out not to feel the same way about them as they did. So this perceived abandonment can really be devastating to somebody, for example, with borderline personality disorder. And the ups and downs of our moods with borderline personality disorder can be quite disconcerting to the person, but also the people around them, and that can lead to a lot of interpersonal difficulties. So mood swings are often a central feature or what somebody will complain of being a problem in borderline personality disorder. That's a feature, the mood swings or mood lability or labile mood, is what often draws clinical attention or the concern of people around them, because it's almost like walking on eggshells sometimes, where the person's mood will be fine or happy one minute and the next minute they're crying or something happens, and something relatively minor to somebody else may be really devastating to that person. So there's often a lot of mood swings. Now, I prefer to call it mood lability, and that's maybe a more technical, proper term for what you see in borderline personality disorder. There's mood swings, but it's really choppy. It's very up or down and very quick to change. Usually there's a trigger, but not always. Now, it's a lot faster and intradaily. So within hours or minutes, somebody's mood will change to one extreme or the other. And there's no almost middle ground. Whereas with bipolar, the mood swings occur typically over much longer periods of time. So somebody who has bipolar will have, let's say, a manic episode where they're euphorically high and dysfunctionally elevated or irritable mood with hyper religiosity or hypersexuality or impulsivity or doing more things productively or not sleeping much and talking a mile a minute. But it's different than the ups with borderline personality disorder that tend to be much more brief and less pronounced. With borderline personality disorder, there may be quite a bit of impulsivity, but it's different than border or a bipolar mania, where it's usually a sustained kind of up that occurs for days or weeks and really is not the person's baseline. In contrast, the person with borderline personality disorder, the mood swings and the insecurities perhaps and the anxiety and angst that is really persistent throughout their life and really is their baseline. Whereas with bipolar, a manic episode or a depressive episode is not their baseline. Their baseline is usually really pretty good, assuming there's not other issues there, such as anxiety disorders. Now, with borderline personality disorder, the way I see it, and to see my patients with borderline personality disorder, there's just a lot of anxiety underneath that. It's commonly, but not always, associated with some kind of abuse as a child. So a more emotional content of the abuse. So sexual, where boundaries get crossed, physical and emotional boundaries are being trampled on or disrespected or ignored when the child is being brought up. And so that can lead to a lot of distortion of relationships and interpersonal boundaries as an adult. So what they don't learn as a kid, they have to learn as an adult as far as how to manage relationships emotionally in regard to emotional boundaries and physical boundaries too. Now, with borderline personality disorder, the mainstay of treatment has traditionally been therapy or counseling, particularly a type of counseling called dialectical behavioral therapy, or DBT. Now, a core feature of this type of therapy, DBT, is trying to find the middle ground and the gray zone in life and have the person come to terms with the often ambiguity or uncertainty of life and especially relationships. And that people can be, some good and some bad, but most of us are a combination of the two and have good parts of us and bad parts of us, and we're not all one or the other as far as enemies or the best person in the person's life, So it's often a focus of therapy coming to terms with the gray zone, the middle zone that exists so much in our life that we have to be comfortable with. Now, I'm a psychiatrist and I don't do a whole lot of therapy, but I use medications often. And a lot of times the therapy can be either too expensive or unavailable or just not effective. Or perhaps the person has comorbid depression or anxiety or bipolar. I mean, you can have borderline personality disorder and other mental health issues, substance use, different things, and of course, trauma, and different things like PTSD. So oftentimes, it's not just one thing occurring with somebody. But with borderline personality disorder, there's not any FDA-approved medication specifically for borderline personality disorder. Now, that sounds terrible, but in fact, we do use medications often for borderline personality disorder with therapy, and we emphasize therapy, especially the DBT. Now, the medications that have been probably most effective, according to studies from what I've read and what I've seen in my practice, are medications that address the underlying anxiety, and primarily that consists of SSRIs. So like Prozac, that's my big go-to for a lot of people fluoxetine it's called. Other examples would be sertraline or Zoloft or Lexapro, Celexa, Luvox. There's a number of them out there. Other medications that are used to treat the anxiety would be like SNRIs, such as Effexor, Cymbalta, Pristiq, and Trintellix. Some are more effective than others. Again, my go-to is typically Prozac. Now, sometimes people will not do great just on one of those medications. Sometimes they need a little bit of a mood stabilizer, such as lamotrigine or Depakote, or one of the atypical antipsychotics like Abilify or olanzapine. So while we use medications that are aiming at that underlying angst and anxiety and the depression, particularly if there's suicide attempts or suicidality that occurs with a borderline personality disorder, the antidepressants can be very important to keep the person out of that pit of despair and hopelessness. But sometimes the mood stabilizer is required to kind of level things out a little bit. So there's a balancing act there between medications. And sometimes one medication can be really, really effective for somebody. Sometimes they need a little bit of a combination, but it's important to address the underlying anxiety there. I really avoid benzodiazepines like clonazepams and alprazolam like Xanax and Valium. Those medications are very addictive. They're depressants. They're dangerous in overdose. So a person who is prone to perhaps higher risk of suicide or suicide gestures or behaviors, an overdose, giving somebody a medication that is more dangerous than other options is probably not a good idea. So I tend to stay away from the benzodiazepines and medications like that. So yeah, borderline is treatable. It's not a death sentence by any stretch of the imagination. There's a lot of hope with it, and the people that I find that I work with who have borderline personality disorder tend to be very strong emotions and care a lot. You know, these are people that care about relationships and themselves, and they want to do well, and they just struggle with regulating their emotions. So that intense caring, wearing their heart on their sleeve, can be a good thing because it can lend itself to connecting with other people on an emotional level. But if your heart is on your sleeve, like literally, if it was there, it would get bumped a lot, right? And that would hurt. So sometimes it's important to kind of help tone it down so that the person's emotional regulation is a little bit stronger. And medications can help that without ideally turning the person into, flat, emotions. But honestly, the medications that are used with borderline personality disorder are not really heavy duty, or they shouldn't be heavy duty medications. Again, just addressing the underlying anxiety and stuff is where the money's at, so to say. Okay. All right. So thanks for watching the video. Really appreciate it. Please subscribe to this channel. If you have any other questions that you'd like me to answer or expand on, please feel free to ask me in the comments. Take care.